As we have previously covered during this hormone course, your thyroid hormones orchestrate many of the other hormones in your body. So it is very important that we identify your thyroid hormone levels. Even if they are at suboptimal levels, they can still be affecting you and causing you some unwanted symptoms. You will come to learn that there is a big difference between normal ranges and optimal ranges when it comes to these hormones. We need to see all thyroid hormones to truly see what is happening. These hormones include thyroid stimulating hormone, TSH, free T3, free T4, reverse T3, antithyroglobulin antibody, antithyroid peroxidase antibody, and thyroid receptor antibody. Let's have a look at how they work. The pituitary gland produces TSH, which tells the thyroid to make thyroid hormone free T4. This hormone is made by the thyroid but is inactive, so it doesn't do much yet. Thyroxine medication is also T4. This is what is prescribed through the medical fraternity for hypothyroidism or Hashimoto's. That free T4 or thyroxine then has to be converted by the body into free T3 to be used. However, there are a few things that get in the way of the free T4 converting into free T3, causing it to instead turn into reverse T3 or just stay as free T4. Some of the factors that will cause this include deficiencies in nutrients needed for the conversion, high stress levels, inflammation, infection, gut issues, or poor liver function. The other three markers are referring to antibodies that can be attacking the thyroid or causing thyroid disease. These include antithyroid peroxidase antibody. This marker is found raised in Hashimoto's disease, otherwise known as autoimmune thyroiditis. Hashimoto's is when the thyroid is being attacked by the immune system and slowly destroyed, causing low thyroid hormone production. Elevated levels of this antibody demonstrates that you either have Hashimoto's or are going to have it soon, along with a subsequent reduction in thyroid function. Elevated levels are found in virtually all cases of Hashimoto's disease, and they will also be raised in 70% of individuals with Graves' disease. Antithyroglobulin antibody. This marker is often raised alongside antithyroid peroxidase antibody. It can represent thyroiditis, which is inflammation of the thyroid gland. As we have discussed, this is named Hashimoto's thyroiditis. The presence of these elevated antibodies in 85% of patients will be due to Hashimoto's thyroiditis, 45% due to thyroid cancer, and 30% of cases due to Graves' disease. Thyroid receptor antibody. This marker is for Graves'. Graves' is the autoimmune condition where the thyroid produces too much thyroid hormone. This occurs when the antibodies target the TSH, thyroid stimulating hormone, receptors in the thyroid gland and activate them abnormally, which causes the thyroid gland to overproduce thyroid hormones. The TRB is specific to Graves' disease, whereas the other two antibodies can be raised in both Hashimoto's and Graves'. Have a look at this table to identify if your thyroid hormone markers are sitting within the optimal range. The first marker we want to look at is free T4. We want to see this between 15 and 19. There needs to be enough free T4 to convert into free T3. The free T3 hormone is the important hormone as it's the active one, so we want to see this level sitting between 5.5 and 6.8. Next, let's look at the reverse T3 level. This should be between 170 and 350. The clinical term for low thyroid hormone production with the absence of elevated antibodies is hypothyroidism. When the levels are not outside of normal range but are on the low side, then it is considered subclinical hypothyroidism. The clinical term for high thyroid hormone production with the absence of thyroid receptor antibodies is hyperthyroidism. Now, looking at your thyroid antibodies, can you see if any are out of range? We don't want to see any of them sitting above their ranges. If they are elevated, you could be dealing with a current state of Hashimoto's thyroiditis or Graves' disease. Please refer to this table to identify what your marker imbalances represent. Antithyroglobulin antibody should be less than 115. Antithyroid peroxidase antibody should be less than 34. Thyroid receptor antibodies should be less than 1.75. If you have discovered that you have raised thyroid antibodies, not to worry. There are ways that we can reduce these levels naturally, which we will cover in the following chapters. The issue you will find with generic testing done through the medical fraternity is that they can only first test TSH, and it's not until that is out of normal range that they are able to request testing for free T4 or free T3. And unfortunately, this normal range is so broad that the likelihood is that your TSH levels won't be out of range. Therefore, your free T4 and T3 won't be tested. You won't know what your thyroid is doing, and the doctor will tell you you're fine. However, even if your TSH is out of range, and they do test your free T3 and T4, again, they are looking at this normal range. That does not take into account optimal thyroid levels. So, to summarize, if you have discovered that you have low thyroid hormone levels, then we can support your body's own production of these hormones. If you are on thyroxine medication, then we can help the body to convert it more effectively to the active free T3 hormone. And if you have currently high levels of thyroid antibodies, then we can support the immune system in order to lower these and minimize the impact of this autoimmune disease on your life and your symptoms. We are here to help you to thoroughly test your thyroid hormones and then offer a successful alternative to assisting you in getting the help you need to feel good again.